Hello, this is Dr. Krishna Mohan Koganti, Senior General and Laparoscopic Surgeon at Reno Hospital, Skompally. Today, we'll be discussing about the common symptoms and presentations of the patients in our O.P.D. Most of the common symptoms in presentation, one among those is the complaints of bleeding per rectum, pain in the anal region, and painful defecation, and swelling in the perianal region with history of fever and sometimes with history of loss of appetite, loss of weight, and pain in the abdomen. So a thorough history is in this evaluation, a thorough history is required to know the duration of the symptoms and the presentation and with history of constipation. So most commonly we need to evaluate through rectal examination and proctoscopic examination. So on clinical examination, we might notice the bulgings, the hemorrhoidal pile mass, either it might be external or sometimes the fissures might be noted either in both anterior region and posterior region, and there might be swellings in the perianal region which might be tender with signs of inflammation. And sometimes on proctoscopic examination, we might be able to see whether there is any signs of fecal impaction, any growth, any signs of gastrointestinal bleeding either from the lower GI or from the upper GI. So on proctoscopic examination, we might be able to evaluate the internal hemorrhoids or if there are any growths which might require further evaluation through sigmoidoscopy and colonoscopy, and either they might require further MRI pelvis, CECT abdomen to evaluate further to know the progression of the disease. So the biopsy also will indicate whether there is any predisposing factors for the tumor-like condition like anorectal carcinomas or colonic cancers. So on further evaluation, depending on the problem, we might suggest the treatment plans. So most common predisposing factors for all these problems would be the constipation. So we would advise the patient to take plenty of fluids, adequate fiber in their diet. So in the evaluation of hemorrhoids, the hemorrhoids are graded from grade 1 to 4, and depending on the symptoms, we would advise the patient either initially for conservative treatment with good hydration, good fiber diet, and laxatives in their diet. So then the progression would be taken care of. So if in spite of the conservative treatment, if the patient does not respond to the conservative treatment, we would advise for the further procedures, surgical procedures, either through the recent advancements like laser hemorrhoidopexy or conventional hemorrhoidectomy or stapler hemorrhoidectomy or some sclerotherapy like treatment plans. So in cases of fissures, we would advise for fissurectomy and lateral anal sphincterotomy in the surgical treatment. So in cases of any growth which is noted, we would advise them to go for further evaluation like sigmoidoscopy, colonoscopy, and if required, CECT abdomen and the biopsy, and plan according to the disease, the situation, the site of the disease. So in cases of perianal abscess, if there is any swelling, inflammatory swellings with history of fever, we would advise to go for an MR fistulogram to evaluate the perianal abscess. So further there is a grading of this perianal abscess. Depending on that, the patient might require drainage of the perianal abscess, and either if the internal opening is identified, we would like to go for either fistulotomy or fistulectomy or set-on placement depending on each individual cases.